Malaria is an endemic disease that affects many African countries. Ghana, a country of more than 32 million inhabitants located in West Africa, is one of the regions affected by this disease. The climate, rainfall, and tropical conditions have made malaria perennial in the country. In order to effectively combat this disease, the Ghanaian government, through the National Malaria Control Program, has undertaken various actions which have had a significant impact.
Across the country, everybody is at risk, but as we know, the pregnant women and children under 5 are most at risk. The situation is not the same across the country. It's heterogeneous. Last year we had a parasite prevalence survey, and the survey shows that among children under 5, parasite prevalence was around 8.6, which is a great reduction from the 2011 figure of 27.5. When you look at the deaths recorded in our health facilities, that has also decreased considerably. Last year we recorded 155 in our health facilities compared to the thousands that we used to record in the 2010.
Indeed, since 2012, the country has seen a 90% reduction in the number of confirmed deaths due to malaria. Despite this reduction, the disease remains a dominant health threat, with an estimated 4.9 million people affected in 2019.
Currently, when it comes to admissions due to malaria, last year we were around 400,000. That's been a slight increase over the previous year admissions, whilst the number of people who attend the OPD due to malaria has reduced from around 6 million to 5.5 million. These are the confirmed cases of malaria. So as a country, based on the reduction in our deaths and based on the fact that some regions have very low malaria, we actually have moved the paradigm. We've shifted to move the program into an elimination program where we are doing, we stratify the country and we'll be targeting subnationally areas which are low, try and move them into elimination whilst we work to bring the areas with high burden down.
However, the Ghanaian government, which with the support of development partners has been the main driver of malaria control efforts, faces limited resources to support its interventions. It is in this context that the EcoBank Group, through its foundation, in partnership with the NGO Speak Up Africa and the RBM Rollback Malaria Partnership to End Malaria, developed the Zero Malaria Initiative work in the country. This aims to stimulate the commitment of the private sector in the fight against malaria in Africa. It is implemented in 5 countries on the continent.
The Zimblick project in Ghana, EcoBank Ghana worked with the EcoBank Foundation based in Lomé and also Speak Up Africa to conduct an initial assessment, a kind of a situational analysis of the malaria situation in Ghana. That study led into us identifying how endemic malaria is in some regions of Ghana. It also helped us to identify how the malaria burden impacts individuals, households, businesses, and the country Ghana as a whole, as well as also identifying the funding gap that is required in the fight against malaria. So that is how, the genesis was. This is how it started.
The country thus joined Senegal, Burkina Faso, Benin, and Uganda, becoming the second English-speaking country to launch this innovative initiative. This should stimulate national private sector engagement efforts.
What we have done is to launch the Zimblick initiative, the Zero Malaria Business Leadership Initiative here in Ghana, as the main vehicle we are going to use towards elimination of malaria in Ghana. What we have done post the launch is to set up a steering committee The steering committee is working to further mobilize funds from the private sector and inject same by way of disbursing the money into the endemic areas in the fight against malaria. So what we are doing now is to mobilize private sector participation, which is what the present job we are doing. So once we get them, like-minded organizations to contribute in cash or kind towards the cause.
In the implementation of the Zero Malaria Initiative, companies are committed. Ecobank Ghana works closely with the NGOs, Pick Up Africa, the government and development partners in order to increase the impact of the project in the country.
Well, our collaboration with Speak Up Africa has been very good. They are a group that is working around the African region. They have so much experience in launching and helping in the implementation of Zimble initiatives in the other regions. Maybe we are lucky in Ghana, who were the last country to launch. So they brought a lot of expertise to bear in helping us. As I said from the outset, even in the assessment situation, they were there with us, and they have been with us throughout and continue to be of help to us. So our collaboration with them have been of so much interest, and also working with the National Malaria Elimination Program. Very, very effective collaboration.
I think it's a very good initiative. We've always been looking forward to work with the private sector because we believe that malaria control or getting malaria out of the country is not only a problem for the public sector to work. We've tried in several ways and different ways. We haven't been successful. So we're happy to eventually launch the Zimble, even that it took us a while. So we are happy that Ecobank has come on board, giving us the platform, giving the seed money. And with what they've done, we hope that it would be an example to other private sector. They have other links that will get more people on board to help us with the fight against malaria. We are hopeful that it will be even more successful because I'm yet to see a country that has eliminated malaria solely on the work, based on the work of the public sector. It's a partnership.
While the Ghanaian government and technical and financial partners provide significant funding to support the fight against malaria, the private sector has enormous potential to further expand efforts to eliminate the disease through financial investment and contributions in nature. Aware of the impact that their involvement in the fight against malaria could have, certain private groups such as Disintegrated Communications Company have chosen to support the fight against malaria in the country.
I think private sector by nature understand the dynamics of building an economy and building people and believing in people and building communities. If the building of a country does not rest on government alone, it's collaboration and it's synergies that are built between private sector and government. I think private sector have a role to play because, we as the engine of the economy, we rely a lot on our workforce. And a healthy workforce will give you a better and efficient run on your business. And we know the struggle of government in terms of the resources and the revenues that come in. And therefore, we also need to complement their efforts. In communities where we operate, we need to take up the mantle of helping. And these days with sustainability and with community social responsibility and all that, we have a role to play. And malaria is the one big challenge that affects everybody and affects communities. So it's one of the key things we need to speak up and get involved to ensure that we can eliminate completely. And I think the National Malaria Elimination Program will not be successful without us.
An opinion shared by Samuel Asiedu, public health specialist and director of a company which is among the most involved in the fight against malaria in Ghana.
Private sector involvement in malaria intervention is good for every country because the private sector approaches business as business. It's not business as usual. And therefore they come in with all the attributes that is related to the private sector, not just limited to resources like money, but they come in with a various capacity building. They come in with the attitude of seeing results, because as a private individual, if you are not seeing results with your business, you would close it down. So you would like to see results with your intervention in order to move forward with it. So the private sector involvement in malaria intervention is needed, and we can't leave it just out for government. It's a social problem, and we should put our forces together in order to work on that.
For each of these companies, a commitment by private sector actors to the fight against malaria would not only eliminate the disease, but also improve the living conditions of their employees.
We have been getting the parliamentarians. We formed that parliamentary select group in parliament who will push for government to spend more money. But that money is still not enough. So who will supplement? We have to also add on in doing our own bit to make sure it becomes a success. So I think for me, I would urge all private sector to come on board, because malaria is a killer disease. We came together during COVID, and private sector really supported the government to fight the COVID pandemic. Malaria can't be eliminated from Ghana. We can't join forces. We should be advocates, and we should, within our own business, begin to make it a reality. I mean, instead of giving at Christmas, give your staff ITNs. Make sure that they're sleeping in them, and use that as a bait to get your staff healthy. Private sector is the engine of growth, and therefore let's rise up and make sure that zero malaria starts with us, and it moves Ghana to greater heights.
Malaria elimination in Ghana should not just be left for the government or the public sector. It includes the public sector. However, the private sector is involved, and the communities that we work in are also involved. I would encourage other private sectors, those in the mining industry, those in telecommunication, the banking and finance, oil and gas companies, agricultural companies, the transport companies, the airlines should all come on board, because we need each other to live healthy, and as we live healthy, we can do proper business. Malaria is having a big effect in our country, and we need all the resources available for us to eliminate so that business can be done properly.
Thus, with sustained efforts, it will be possible for the country to further reduce the burden of malaria and achieve the objective of pre-elimination. Like Ghana, Uganda also intends to increase its strategies to eliminate malaria within its populations. Indeed, this East African country is one of the most affected by malaria in the world. Also, the disease is preventable and treatable. It constitutes a great burden on the health of populations in the country, which in turn imposes a major socio-economic cost on development efforts. It is to overcome this problem that the Zero Malaria companies are committed, initiatives supported by the EcoBank Group through its foundations, in collaboration with the NGO Speak Up Africa and the RBM Roll Back Malaria partnership to put an end to malaria was recently set up in the country, becoming the first English-speaking country to launch this innovative initiative. This aims to increase awareness, prioritization, and national commitment to achieve malaria elimination in Uganda through private sector engagements. In the country, the Malaria-Free Uganda initiative is enough to illustrate the impact of the private sector in the fight against malaria.
My position today is to see how I can lead and my team as the board chair for Malaria-Free Uganda, which was started when all the African leaders under what we call African Leaders Malaria Alliance came together, and they were starting to have different boards in every country in Africa so that Africa can be malaria-free by the year 2030. So we believe we are going to do it, but the situation in Uganda is very bad. Being number 3 in the world shows that we must do quite a lot to save those children who will never see their 5th birthday, to save the adults today who are also getting infected because of malaria. And indeed, the government of Uganda spends over $500 million every year on malaria alone. That one should be a very good example to tell you how serious malaria is in Uganda.
Malaria-Free Uganda, MFU, is a board of directors made up of business leaders from various organizations operating in Uganda. It also supports the government in screening, treatment, and vector control. The council was created to mobilize private sector resources in the fight against malaria.
Work what we call the Parliamentary Forum on Malaria. This Parliamentary Forum on Malaria is composed of members of parliament who come from those regions I've mentioned, northern Uganda, eastern Uganda, and part of southern Uganda and western Uganda, who believe that government must do more in the fight against malaria. So what we do, we work with them, we facilitate them to have different meetings all over the country, to do advocacy in their communities, but to change policy on government level, to have all government bodies to have malaria as part of their programs in every ministry and all government corporate entities. That is the involvement we're having with government. We are using the Ministry of Health for training of the village health teams. We are using the Ministry of Health to use their budget to promote advocacy programs so that together we can join hands and fight against malaria.
Thus, for Kenneth Mugisha, president of Malaria-Free Uganda, the EcoBank Group's Zero Malaria Initiative appears as an opportunity to boost the effort made in the fight against malaria in the country and to obtain best results.
The moment I knew the entry of EcoBank, it gave me the biggest smile as a champion against malaria. Today we regard EcoBank as our biggest partner as Malaria-Free Uganda. We look at EcoBank and assembly that it is doing the best from the corporate world, giving back to your customers and people who have made EcoBank what it is today. And the most important thing is EcoBank realizing that it needs a healthy population. People who can use EcoBank, people who believe that the action of EcoBank is doing today under assembly is what other corporates must do. Leading the way, we thank EcoBank in a very special way. It is these partnerships we are looking to. Now, EcoBank, we look at its assistance in this campaign, that we are going to help so many organizations. For example, in Uganda now, the support of $200,000 using EcoBank Uganda is going to go a long way. Number one, to support the blood banks in Uganda. We have 2, the National Blood Bank in Nakasero, run and controlled and managed by government. And the second one, the Rotary Blood Bank at Mengo Hospital, a missionary hospital.
The Malaria-Free Uganda initiative boosted the government's fight against malaria by donating around 21,000 US dollars to the Ministry of Health. A large part of these funds was raised during the Malaria Family Carnival, organized in December 2022 in collaboration with the Rotary Club. EcoBank, for its part, supplemented this pot with an additional donation from its Zero Malaria Businesses Get Involved program, bringing its total contribution to approximately $43,000. It is also a prelude to the preparation for Malaria Family Carnival, scheduled for next December, that stakeholders gathered under the veil of a light star sky for a meeting.
I started developing a hiccup. We are going to have the second edition of a Rotary Family Carnival. And this carnival brings all Rotarians and corporates together for resource mobilization in Uganda, so that we can do and take action, spraying people's homes, planting mosquito repellent plants, which chase away mosquitoes from coming near communities, and many other interventions, including the most important one I can talk about today, which is advocacy, spreading knowledge to these communities in the rural areas where there's poverty, advocacy using our radio programs, using the media houses, reaches even the unreachable in Uganda. And through the support of EcoBank, we can afford to do everything.
EcoBank Uganda has joined the fight against malaria in 2022 with a 120,000 US dollars matching fund, which was launched in March 2022 to support Malaria-Free Uganda's ongoing efforts to mobilize private sector businesses in the fight against malaria in the country. This matching fund is to be used to match any private sector contribution for malaria, to encourage other private sector companies to join the fight against this deadly disease. A fight that is also being waged by Matt Ahazia, sales manager in a private company in the country. That morning, he came with a few colleagues to a local market in Kampala, the capital, to present, distribute, and educate traders about a new product put on the market to fight malaria.
Basically, we have done a lot of random market sampling and a lot of outreach. We haven't put so many shopping points across the country so that our common people can easily meet this product within their easy areas, within their respective areas where they reside. We are helping the country also to make sure that the people live a good health and a good life, so that they can do their livelihood very easily. They can do their activities when they know their health is guaranteed.
He also believes it is important that private sector's companies join the initiative to fight malaria in Uganda.
Basically, in Africa, or let me say Uganda, private sector is doing quite a good job in helping spread of awareness. And again, we are now partnering with Malaria Free Uganda. Let me say it is a private sector. We are doing quite a lot to help people fight malaria. We give the real product to use in their homes to fight malaria, calling upon all private sectors to join hand in fighting malaria because it is one of the deadliest and cheapest disease around, but it takes so many lives. And really, when we fight together, we come together in numbers, everyone is doing their best to make sure we have a better population. We really do a lot of good job.
In Uganda, the private sector is very important and occupies an important but delicate position, particularly in relation to health maintenance. Given this enormous but limited capacity, there is a need to find a hybrid, public-private approach to enable the private sector to contribute to the achievement of health strategies in general and malaria in particular. The Zero Malaria Business Commitment Initiative provides an excellent model for realizing this aspiration.